So I'm going to start on this leg because he says he has a little bit more issue with that. So Mike, listen, as I move you around, if anything is uncomfortable, just let me know, okay? So I want to see here. When I bring your leg up, is this okay? Mm-hmm. All right, cool. There we go. How does this feel so far?
Okay.
Okay. Now, I'm using his leg as a handle to reach down and around. So it's like he's rocking his sacrum, it's rocking his pelvis, it's accessing his lumbar spine, even though he's on his back. And you'll notice I did this without even thinking about it. Like I'll look at his face because I'm looking to see if his vibrometer goes off. So as I roll you just a little bit over, like how does this feel?
Good.
Yeah. Does this feel better than that external rotation?
Yes.
Okay. So that's kind of what I'm going to focus on. I'm always going to go with what he feels regardless of whatever my brain says anatomically or whatever. I'm going to put one knee down. I'm going to bring his knee to his opposite shoulder. How's that?
Good.
Okay. Piriformis, more so. Gluteals. But when I bring you over further, how's that?
Good.
Good. Okay. So in his case, as I bring him over, what does he start to get worried about?
Falling off.
Yeah. So I'm gonna change it up just because I want him to feel safe. So when I'm over here, I got this larger client. I'm gonna come over, and when I say larger, I mean to me. How's this?
Oh, good.
Good. Okay. If I had you over here, can you hang out there for a second?
Yep.
All right. Cool. So this feels good.
Yeah.
Would you want the knee a little bit higher?
That feels okay.
Feels okay, or are you fine just there?
I'm okay there.
Okay, so big in breath for me. And exhale. How's that? How's that on your back?
Feels great.
Feels great. Now, if I had done that and he said, "Oh, no, 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 no," you just stop. You give him less stretch. It's less intense. I'm going to bring him to his range. Just that, how does that feel?
What do you mean?
I mean, how do you feel?
I feel fine.
Do you feel better than when we started?
I feel good.
Yeah. It's simple. How much compression did I use on my hands?
None.
Very, very, very little. And that's part of the trick. It's like it works in a slightly different way than I think we're sometimes familiar with. I'm going to give him another variant because I'm going to bring his leg out straight. How's this? Is that too much on your hamstring or IT band?
Mm-hmm.
Okay. When I'm right here, how's that?
Good.
Good. Okay. And in his case, I'm going to give me a little bit more space on the table. I'm going to get my knee right here so I can block. How's that?
Good.
There we go. How's that around the trochanter right there?
Right where your hand is where I have my issues.
Right here?
Yes. No.
Right there.
Yes.
Elbow.
Oh.
Couldn't tell what I was
Can't see.
using. No, it's fine. They'll never know.
Close.
Right in there?
Uh-huh.
Okay. Now, if I bring you over a little bit more, it's not too much twist?
No.
Okay, I'm just trying to make sure he feels comfortable. Right in
Although
there.
I do have that feeling of falling off. the
Right in
table.
there. Yeah, he's a little bit further over because I changed my position. So I've kind of found out it was right around his greater trochanter. There's this little, so I'm trying to think, okay, is it gluteus medius? Is it piriformis? Like what's connecting there that's causing the issue? In his case, I might take him and put him prone and then going to take a look at the gluteals. Can you flip over for me real quick? More on this side, correct? More on this side. See what he flipped over. That's why I get confused, even me. So in here,
Yes.
okay. And then a little more, is it more lateral out here? This feels denser to me. In there? Okay. So I'm going to use a big, broad jostle first, just because of the groans he's giving me. How's this? Good. I can reinforce my fist here. Because I'm just trying to soften tissue and figure out where we're going to spend time working. Right in there. Real low. So this is nice because this is approximating more the mat, right? Now here's what's nice about the mat. Hey man, how's your gluteals right in here? How's that? There we go. Okay. Now how's that on my hands? Yeah. Oh, right there. Now, I'm still around the greater trochanter, but anything in the flesh of the gluteals is totally fair game, okay? We showed just like a quick mobilization, lengthening, stretch. I use my forearm and elbow to compress it first, and that's sharper. Normally, this is what I'm going to use to bust up concrete. This is what I'm going to do in spot work and use a pickaxe. Clean it up, right? So I'm going to slide off my shoe here so I can get a foot up. How's that right there? If you had to choose, is that the spot I'd hang out in?
Maybe.
Or there's a little more posterior? A little more up and over? So in there?
Right in there, yes.
There we go. So now, very quickly, what he wants me to do is mat work. Right there? Okay. More pointed?
That feels fine.
There we go. Do you like the rock?
Mm-hmm.
Okay. Now, how much strain is this on my hands?
None.
Exactly. It's also part of the reason that the sessions are 3 hours long. I'm distributing the work over all of my body so I can go longer as far as the session. I'm going to get a little bit higher. Right there. How's that? Perfect. How's that? That's the bulk of my body weight. How's that?
Sorry. I'm sorry.
Now, in the West, how do we feel about massage therapists getting on the table?
I usually get a, oh, wow, you're on me.
Yeah.
You know what? If you didn't tell me and I'm sitting here laying down, I don't know the difference.
You wouldn't know. So what about right there?
Elbow or what?
You like the more point than that?
Feels fine.
Okay. But if you had to choose more like that?
Oh, yeah, that's good.
There we go. We're just doing a gentle kind of mobilization. You saw that I took the knee towards one shoulder, kind of gave him a little twist just to see what was going on. Then we use some compression. If you don't feel as comfortable using the knee or you're on a table, like if I try to do it over here, how's it going to work? The angle's more to the side. Also, if I get up on this table, I'm now like almost twice as high off the ground. Make sense? As a male therapist, how did female clients feel about me getting on the table to work on them?
They probably wonder where you were in space. What are you doing?
Yeah, culture. It doesn't mean I was doing anything untoward. I was just working on gluteals. But I have to keep that cultural context in mind when they put you up over their knees or whatever, and you're like, either it was too much physical strain and then culturally you didn't know what was going on, right?
It was painful to me.
Oh, it's painful, yeah. And I don't want it to be painful. It can be intense, though. Was it intense, Mike?
I don't think it was intense.
It wasn't
felt
intense?
great.
Oh, okay. Felt great.